Now, a Durban mother and her newborn have tested positive for COVID-19 at a local private hospital. It's one of the first cases in the country where a newborn was infected with the disease. According to the hospital management, the case is now further being researched to just understand the nature of the infection and the virus itself. Our reporter in Durban, Karinda Jagmohan, joins us now from the Ahmed Al Kadi Hospital. Karinda, good morning to you. Just as the province is bolstering its efforts at intensifying screening and testing, we learn of a mother and a newborn who've tested positive for coronavirus. Tell us more about this case.
Good morning to you. Indeed, it is a unique case stemming from Durban for the country. It's yet to be confirmed if this is South Africa's first case where a newborn has been infected with the virus. But just to take you back, we did speak to the board chairman of the Ahmed Al Kadi Private Hospital here in Durban, Dr. Ayub Bucks, and he explained to us that the woman had come to the hospital to be admitted, of course, to give birth to her child. Upon her admission, as in line with the regulations of the hospital and the Department of Health, she was tested and ultimately tested positive for the coronavirus. However, she was admitted into the hospital as per the regulations with the Department of Health and the hospital for a COVID-19 patient in order for those around her and herself to be safely kept here. We do understand from Dr. Bucks that the pregnancy or the childbirth rather was uneventful, meaning there were no major challenges or hiccups during the childbirth. However, after the baby boy was born, he did test positive for COVID-19. They have been recovering. Both mother and son have been discharged from this hospital. The father has since tested negative for the virus. It's unclear, though, his status at this time now. However, we did ask Dr. Bucks about how it was that the newborn was infected. Did this infection come directly from the mother, and how so? He explained to us, though, and reminded us that the COVID-19 infection is a droplet infection, meaning that this virus is passed on to one another by forms of droplets, so droplets coming out from one's mouth or nose. However, researchers are still looking into the infections of newborn babies. This is what Dr. Bucks told us in terms of how this baby could have been infected.
There has been a lot of interest in the COVID positive mother and her baby at Ahmed Al Kadi Hospital. In fact, it was the first COVID positive mother that was delivered at Ahmed Al Kadi Hospital, and I think it was actually the first COVID positive mother in South Africa. So a term mother was brought to Ahmed Al Kadi Hospital for admission. As per the normal protocol, all patients admitted to Ahmed Al Kadi Hospital are tested for COVID-19. Unfortunately, she tested positive. She was subsequently taken to theatre for a cesarean section. The operation was uneventful. All procedures and protocols as per the Department of Health guidelines were followed, and she delivered a healthy baby boy. The boy was subsequently tested for COVID-19 also, and unfortunately he also tested positive. So here we had a situation where both the mother and the boy and the baby had tested positive for COVID-19. Fortunately, both the mother and the baby did exceptionally well, and they were subsequently discharged home. As a follow-up, the father of the baby also had to be tested, and the good news is that he was negative.
Now, Karinda, just listening to that, we also know that researchers at the Wuhan University in China who've recorded cases like this have said that newborns will perhaps get by with only mild infection symptoms. When it comes to some of the research that will follow, what do you know about this case?
Yes, indeed, we do know, and according to Dr. Bucks, that researchers are, of course, interested in further looking into this particular case. Like I said, it's yet to be confirmed whether this is South Africa's first case of a newborn being infected with COVID-19. At the moment now, we understand that doctors here have made special arrangements for researchers to further look into this case. We did ask Dr. Bucks about the interest in this hospital and the woman and a child. This is what he had to say.
Research relating to COVID babies and COVID pregnancies are still a little sketchy. However, I can say that there is presently no evidence that the infection is transplacental. This means that the spread is not through the amniotic fluid and is unlikely to be through the blood of the mother to the baby. There's also no evidence that the virus is spread through breast milk. Some babies, unfortunately, may test positive, not because they have the infection, but because of the transmission of antibodies from the mother to the child. So in all probability, this baby was probably infected because of the postnatal contact. We obviously cannot keep mothers and babies apart, so there is a risk of infection from the mother to the baby. But what is encouraged is that for mothers to wear masks when they are breastfeeding, to adopt strict hand sanitization at all times, and these few steps will go a long way in preventing the baby from becoming infected by her mother.
Well, this is what Dr. Bucks had to say with regards to the new case unfolding here at this hospital. And going forward now, of course, we're still yet to see how researchers will further figure out how to understand this case and contribute it to our understanding of coronavirus infections across the world.
Let's leave it there for now. Of course, our reporter Karinda Jagmohan giving us the very latest on this case. We will continue to take you back to the streets as we find out more about this case and the research that's coming up.